symptoms, like what Miss AJ said earlier, when you have a high blood pressure, you feel normal. You don't think something is wrong, but there is something going on that you might call silent killer. Um, some of the risk factors of high blood pressure is high sodium diet, obesity, smoking, stress, lack of exercise, and family history. Family history is really, really a big thing because if you know that your father or your grandfather or your mother or somebody related to you has a high blood pressure, I would tell you start checking yourself early because there's a tendency, it's a generational thing that pass over. And sometimes we take it for granted. Prevention, you want to check your blood pressure regularly. You want to eat less salt, more fruits and vegetables, exercise at least 150 minutes per week or regularly, which I know is not going to happen, but just try. Try the best you can. You want to take your prescribed medications consistently. So, why I say consistently is because a lot of men in our community are known for high blood pressure, and once they get prescribed medications, they do not. When I say they do not take their medications. And one of the main reasons why most men don't take the medications is because of the side effects. And one of the side effects is a reduced libido, which is they do have experiences of ejection. So most of the time, they try not to take it. And it's also risky because if you don't take your medication as prescribed, you are causing more harm than doing good. And maintaining a healthy weight. So if you're obese, now obesity, the American Heart Association have changed what is considered obese. So if you think you're 150 pounds and you think you're okay, you are not okay. So just to let you know, they just want you to maintain a weight. If you're exercising regularly, they want you to maintain that weight as well. Um, and know your numbers. Like you guys already said earlier, a normal blood pressure, your normal systolic blood pressure is supposed to be anything less than 120. The top number has to be less than 120, and the bottom number, which is your diastolic blood pressure, has to be less than 80 to be considered a normal. Okay? Um, the next topic, high cholesterol. So when we talk about high cholesterol, we have the LDL and the HDL. So the difference between those two is that the LDL is the bad one, the bad cholesterol, which can develop in your arteries and increase your risk of having stroke. If you have a high cholesterol and then you have a high blood pressure on top of it, you are just calling for death. Let me just put it that way. Because there's a tendency that you are prone to having stroke, which can lead to death. And a lot of times, for me, working in a hospital, I've seen a lot of patients come in for stroke and sometimes never recover. Sometimes it's a progression, a long road to recovery for them. Because depending on the type of stroke that you have, your recovery time can be even longer than you expected. So it's very, very important that you want to check your cholesterol level. If you don't know how to check your cholesterol level, please visit your primary care doctor. The high cholesterol, the HDL levels is the good cholesterol, which helps remove excess cholesterol from the bloodstream. And the way you can prevent it, like I said earlier, maintaining healthy weight, exercising regularly, eating a healthy food. So the heart healthy food can be something without salt. Make sure you try to prevent that high sodium diet. Our next topic would be diabetes. Diabetes is also one of the leading causes of all the heart diseases that you can have. There are three different types of diabetes: type 1 diabetes, type 2 diabetes, and gestational diabetes. So with a type 1 diabetes, most of the time, people is a lifelong insulin requirement for this person. So this person is actually born with this disease. There's no way that they can even turn around from it. So it's a lifelong thing. But maintaining your insulin level, checking your blood sugar level regularly is very, very important for this type of diabetes. For the type 2 diabetes, you want to maintain your weight, you want to exercise regularly, and you want to focus on your diet. It's not an insulin dependent diabetes where you are on it for a lifelong. But if you don't take care of yourself, you don't follow the regimen that your provider is providing for you, you can be on medications for a very long time, on insulin for a very long time as well. And with that can cause a lot of complications if you're not taking care of yourself well. Gestational diabetes usually happens during pregnancy. So when you're pregnant and your doctor check a certain level, certain time in your pregnancy, they do a glucose tolerance test. Once they do that test and they found that your glucose level is high, they consider you gestational diabetic. That doesn't mean that diabetes is going to go away from you. It's going to happen. You're only going to have that disease during your pregnancy, but there's a tendency after pregnancy that you can be able to develop a type 2 diabetes after that. So, why I'm saying that because when I was pregnant, I had gestational diabetes. And because I know diabetes is a major thing in my family, I'm very cautious, very, very cautious, because I can tell already that if I don't take care of myself, there's a tendency that I'm going to have diabetes in the long run, which I don't want. Some of the symptoms that you might see with diabetes, no matter what, 1, 2, or gestational, you want to notice frequent urination. If you've seen yourself urinating a lot, even though you're not drinking too much, but you keep urinating, that should be a sign for you that you need to check yourself. You need to check with your provider, and you need to bring up this information to your doctor a lot. A lot of times we try to hide information from our doctors, but I will be honest, if you don't say it, you're not expecting the doctor to know what to do for you. Increased thirst. When you're thirsty a lot, just know there's something going on. That's something related to diabetes. You're hungry a lot, something related to diabetes. And you start noticing that you're having some blurred vision, it's also related to diabetes. You're tired a lot. And slow healing wound. With diabetic patients, it's very, very, very hard for their wound to heal. Wound in a sense, if they have like just a little cut, because they don't feel the cell, it's very hard for those wounds to heal. It's AY. Next. All right, so like I said, prevention for diabetes, maintaining a healthy weight, eating balanced meal, staying physically active, monitoring your blood sugar. Always do that. Importance of controlling diabetes to prevent eye, kidney, nerve, and heart complications. So, if you don't try to take care of yourself, take care of your diabetes, these are some of the things that you might have, complications that come after not taking care of yourself. Heart disease, there's a tendency you're gonna have a stroke. There's a tendency you're gonna have a heart attack. Kidney failure, A lot of sugar get into your bloodstream, goes into your urinary tract, causes a lot of kidney issues. Some of the reason why you see people on dialysis today is because they don't take care of their diabetes, which leads to kidney issues. Vision loss. A lot of diabetic patients are having issue with their vision. A lot and lots of them. So you see most of them will tell you diabetes can cause blindness. Yes. So a lot of times you want to really, really make sure you take care of yourself. And if you're diabetic, be on top of things with that. Nerve damage. When I was talking about wound healing, this is the reason why they have wounds that do not heal on time, because they don't feel that they have a cut. If they have like step on a fire or something burning, they would not feel it because they don't have any feelings in that leg. That's what is called neuropathic pain. They don't have that feeling. So a lot of times you see them, they will have a wound, and when you tell them what happened, I don't feel anything over there, so I don't know what happened. And most of the time, diabetes end up in people getting amputation because the little cut turns into something big and the whole leg is gone. So you really, really have to be very careful and manage your symptoms very well. Chronic kidney disease, like I said earlier, the major two causes of it is diabetes and high blood pressure. The early stages may have no symptoms. At the beginning, you might have no symptoms. When you start feeling some symptoms like you're having a hard time going to the bathroom, urinating, you're having pain with urination, you want to check with your doctor. Prevention, try to control your blood pressure, try to control your blood sugar, stay hydrated, drink a lot of water. Like we said earlier, 8 to 12 ounces, 8 to 12 glasses of water is really helpful. Try to flush that kidneys a lot. Avoid using NSAIDs. NSAIDs are like ibuprofen, Motrin that everybody takes. You want to limit your intake on that. Motrin does affect the kidneys. At the same time, Tylenol does affect the liver. So you want to alternate those medications if you're in pain. You really, really want to alternate them. Don't take too much Motrin because it's going to have an impact on your kidneys later on. And not just on your kidneys, it's going to also have an impact on your digestive system. So when you start taking too much of Motrin and you start seeing, like, when you go to the bathroom and you have a bowel movement, you start seeing blood, there's something going on in there. So you have to really, really limit your Motrin, limit your Tylenol as well. I can stress on this a lot. Get your kidney function checked if you're at risk. So kidney function check is usually done in the provider's office, or he can send you to a nephrologist, which is a kidney doctor, to do a kidney function test. When you start noticing that you have, you start getting some symptoms, which is like frequent, like not urinating well, or you're having pain with urination and things like that, severe back pain, you want to check with your doctor. Because the kidney function test can tell the doctor what stage is your kidney is at this moment and what are the treatment options for you. Substance use disorder. I try to talk about this because as a mother with a young teenager, it really gets to me when I have patients coming to the ER for substance use and going through withdrawal symptoms. Sometimes they would tell you it's their first time. They never tried it before. They never used this drug before, and they do have impact on it. And some of the impact, you just wonder to yourself, like, why did you take it? But the substance use includes like alcohol, opiates, cocaine, methamphetamine, cannabis use, nicotine, and other substances that they're selling out there in the street now. Some of the effects can be it can have physical and mental health problems on patients. even the family and the relationship, and sometimes it can have some financial and legal consequences. Encourage your friends or teenagers or family if they're going through a substance use disorder for early treatment. They do have substance use treatment centers all over Maryland. If you know somebody who's going through substance use disorder, counseling can be another help, support groups, medication assisted treatment with when appropriate, and recovery is possible with support and treatment. Don't also forget, continue to pray for them. Prayer does work as well. Any questions so far before I move on? Yes. Okay, sure. Um, yeah. Breast cancer. Breast cancer is something that I want to really stress on for females. If you have a family like your mother, your grandmother, or your sister previously was diagnosed with breast cancer, please, please don't wait till you're 40 before you check yourself. The earliest you can do that is in your early 30s. Please, please try to check yourself, because when your immediate family member has that diagnosis, it's better for you to prevent it than for you to go there later and they said, oh, you have a stage 4, because now there's no way they can treat it because it has gone to that level. So please, please, you want to check yourself. You can do it at home yourself. If you go to the bathroom, please try not to do it during your circle, because it's not going to be, you're not going to find anything. Let me just say it that way. Because during your menstrual cycle, you feel that numbness, that bump, anything can give you a sign. So you don't want to do that assessment during that time. Risk factors for breast cancer is age, if you're getting older. Family history is the main thing, and certain inherited gene changes. So, like I said, one of the warning signs would be your breast lump, skin changes, and if you notice some nipple discharges from your breast. You want to check that out as soon as possible and let your provider know. Prevention, know your normal breast appearance and feel. Discuss mammography with your healthcare provider based on your age and your risks, and maintain a healthy lifestyle. Prostate cancer. Prostate cancer usually is common in older men over 65, heading towards that age. May not cause symptoms at the early stage. Possible symptoms that you will find with prostate cancer would be difficulty urinating. There are a lot of times that the older men would come and say, I need a pee, but the pee is not coming. It's because the prostate is enlarged, and sometimes it's due to prostate cancer that is causing that difficulty for them to urinate. You want to see frequent nighttime urination. So sometimes they do have bedwetting, and it occurs with older men most of the time. Blood in the urine, because the prostate is enlarged, it causes striction on the vas deferens of the male, the urethra, which makes it hard for the urine to come out. And when it's coming out, you will see some blood in it because of the enlargement and the pressure that is pushing on the urethra. That is causing them to have some blood in their urine. Encourage the men to discuss prostate cancer screening with the healthcare provider, especially if they are at high rates. So if your father or your grandfather had prostate cancer before, please discuss with your sons, your brothers, for them to check themselves as well. Even though at an early age it doesn't really show, but later on in life it's going to come up, because it happens. It's an older man thing, but you're going to get there, so you want to check yourself as well. Colon cancer. Colon cancer, right now, I would tell you, it does not have any age limit. It can happen to females, it can happen to males, it can happen to younger generation. It does not have any limit. One of the warning signs, if you start going to the bathrooms, trying to see, have a bowel movement, and you notice some blood, consistent blood in your bowels, please discuss it with your provider. Persistent changes in your bowel habits, if you were going to the bathroom, let's say once a day, and now you're seeing like you going multiple times, it's not diarrhea, but every time you go, you're seeing some blood spots of blood in your stool, you want to talk with your doctor. Unexplained weight loss. So unexplained weight loss is like if you just notice you're eating, you're exercising, your weight is just going down, 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 you don't know what's happening, you want to check with your doctor because it's not normal for you to keep on losing that kind of weight where you're teen, really teen, and it's not a normal thing for you. So you want to talk to your doctor with that. The way you can try to prevent these things is eat a high fiber diet. I know we African, we like beans, so you want to eat that bean. You want to eat that beans as much as you can. You want to exercise regularly, avoid smoking, and limit your alcohol intake. Screening for colon cancer, routine screening begins at age 45 for most average risk adult. The earlier for those at increased risk. So 45 is the normal age range for you to screen yourself for colon cancer. But if you have a family history, you want to do that earlier than that. Cervical cancer, usually this is for female genders, primarily caused by persistent infection with a certain type of HPV. HPV is the hemopapilloma virus that usually happens with females. Once prevention, you want to take that HPV vaccine. You want to have a regular cervical cancer screening, which is usually your pap smear. You want to do that with your provider. You want to do a HPV testing as recommended. Want to also have sexual practices, and early detection greatly improves treatment outcomes. The pap smear is very important. Please, please try to do that as much as you can. So, key health promotion messages that I have for you: eat a balanced diet, exercise regularly, do not smoke or vape, limit your alcohol intake, maintain a healthy weight, know your health numbers, your blood pressure, your sugar, your blood sugar, your cholesterol. With the blood pressure, blood sugar, and cholesterol level, I will tell you, your cholesterol level now, they have not changed it, but with your blood sugar and your blood pressure, please check with your provider because the American Heart Association have certain numbers now. Every single year, things have changed. Sometimes it would say 110, sometimes it would say 115, now 120. So it really, really does change a lot with the American Heart Association and also with the Diabetes Association people as well. You want to check with your provider what is considered normal for me. Usually anything that is 100, like 80 to 100 is fine for your blood sugar, but you don't know, depending on your risks, you want to speak with your provider, what would you consider normal for me? Take your medication as prescribed, and take medical attention early if you notice concern symptoms. Your take-home message: prevention, early detection, and healthy lifestyle choices are among the most effective ways to reduce the risk of chronic diseases and improve quality of life. So please, if you know you have family history of some of these things and you are having some of these symptoms that you're just trying to keep it to yourself, I will promise you, please, please try and speak with your provider and talk about it. Also, try to do your research as well, because I've seen a lot of patients come to the ER, come to the hospital, and tell me, well, Google did not tell me this. I'm like, Google is not your go to person, because anyone can put anything on Google. So if you're having concerns, if you go to the doctor and the first thing he's like, you're not managing this, you're not doing this, can we start you on medications, or can we start you on this? Do your research about those medications first. Look at the side effects of those medications. Talk to somebody who's a healthcare provider, so that way you can have a clue of what you are taking, not just what you are taking and how is it going to help me. So don't go on Google. Google will give you information, but not a lot. So I always try to encourage patients, families, do your research and speak with your provider. Thank you. Any questions?
If you have any questions, I'll be more than happy to bring the mic to you.
So, with regards to the prostate cancer for men, you didn't state how we can prevent it from an early stage in order to avoid it when we get older.
So, what I would tell you at an early stage, you want to check with your provider and do a PSA. Is a test to find out whether you are prone to having that prostate later on or earlier. So, when you speak with your provider and let him know that, hey, this is something that is happening in my family. I have noticed my father had it, my grandfather had it, and my older brother has it right now. Can I do the PSA test to be able to find out whether I'm at risk for it? So early detection will be doing the test, the PSA test. You're welcome.
When you said most of the illnesses that you mentioned, it could also be generational. What do you mean by that?
So
But I think I asked because what if my birth parents, I didn't grow up with them? Because the way I could link it up is the food that they eat also, since that's the same family, you also grew up on. If they eat pound yam, the kids will eat pound yam, and that's how it goes through the generation because they cook the same food. But what if I grew up in the whole complete, like 180 white family in America, why all my families are here? Would that still be the same?
it will be, because one thing I can tell you, you cannot change your gene. You can go and live with somebody else. You were born and get adapted to somebody else, but your DNA, you cannot change it. So you want to do that test and genetic testing to find out what you're a risk for. If you don't check that, I can live with, if I was born from a different family and I go over there to another family, or I was adopted to another family, I want to find out what are the things that I'm a risk for. And through that is through that genetic testing. You want to check that. The genetic testing is the major thing that you want to do. So when I say generational thing, it might doesn't mean that you eating panda yam or and go and eating macaroni and cheese. That doesn't change your gene at all. Yes, ma'am.
I wanted to ask this question because you talked about gestational diabetes and that the person could go on to actually develop diabetes. So what if it's preeclampsia, even after it has resolved itself after like 6 weeks of birth? Can the person still, is it like almost synonymous, or can the person still develop like high blood pressure later? Or once it's resolved, it's not similar to like a case of like gestational diabetes?
So with preeclampsia, like you said, is high blood pressure during pregnancy, and it's very, very dangerous. What I would tell you after pregnancy, you just want to check your blood pressure regularly. It does not happen when it comes to gestational diabetes, but you want to be on a look for it, because with preeclampsia, you never know, even though you're not pregnant, but there's a tendency that you might develop a blood pressure, high blood pressure that you don't know about. So checking your blood pressure regularly will help. Yes, ma'am.
Okay, you talk about eating, well, thank you for doing this, because this is so good. So you talk about eating a balanced diet, and I know in our community, a lot of us suffer from high blood pressure. What are some of the foods that you would recommend for just to keep your blood pressure down? Like, is there like certain vegetables or certain fruits that we should be eating? Should we be eating more protein? Just things like that. Thank you.
So what I would say, you want to eat more proteins as well. Mostly stay away from fatty foods. Stay away from salt is the main thing. Eat more fruits and vegetables. It really doesn't matter what fruit or vegetables, but it has to be more of fruits and vegetables, not salt, not fat, not fried food, not most of the things can be baked, cooked, fish. Stay away from a lot of meat as well, but not specifically on different types of fruits. When it comes to diabetes, you want to be very specific and talk to your provider about what type of fruits, because there are some of the fruits that have high sugar level too. So you want to be very, very mindful on what you are taking. What can you discuss with your doctor when it comes to your diabetes? But when it comes to your blood pressure, I would encourage you more to stay away from fatty stuff, more salty stuff, and things like that, but focus more on fruits and vegetables.
Hi, Ms. Vera. So I know this is not something that you discussed in your presentation, but is there like a risk factor with low blood pressure? Like,
Yes. So with low blood pressure, what you want to do, what I can tell you, if you start noticing yourself a lot that you feeling dizzy a lot of times, sometimes you're dehydrated. Low blood pressure sometimes can be out of stress. Sometimes people don't notice that they do go like have stress, but when they have those stress, they develop some low blood pressure. And if you notice yourself when you check your blood pressure regularly and you notice there's a tendency that you're having low blood pressure, usually your low blood pressure can be in like the 90s over 50, 90 over 60. But if you're not showing symptoms, I would not worry about it. I would just try to hydrate myself more, because you don't want it to go to where it's in the 80s or 70s, then it's considered really dangerous for you. But usually I would just keep myself hydrated a lot to prevent that low blood pressure.
So you mentioned like salt intake, reducing salt. I guess my question is, in what ways can we make our food flavorful? Because me, when salt is not in the food, I can't eat it. So, in what ways can we make our food more flavorful and enjoyable? That's my question.
Okay. So I I don't know how I can tell you. I don't know how to stress this more. Um, when I say load your salt intake, I'm not saying get away from it totally. You can put a tiny bit of salt, but not excessively. Okay. I know most of us, if the food is not tasty, we're not going to eat it. But if I know that I have a high blood pressure issue, I think I would rather eat the food that way than to put enough salt to cause more harm. Okay? But you can go ahead and put your salt, but just make sure you are doing it in a moderation.
So really quickly, because it just came up here, can you talk a little bit about the different types of salt? For example, Himalayan salt, light salt, rock salt. are there different salts that are better for us to use in cooking?
So the salt that I would tell you is the iodine salt. That's the best because the reason why I would tell you to use that when you're cooking is because you're also preventing issues from thyroid. So if you don't try to use the iodized salt, you are causing more harm to your thyroid gland. And when you start having thyroid problem, then you're looking at you're looking at problems where you're having like hypothyroidism, hyperthyroidism, which is high thyroid levels, low thyroid level, and sometimes it's a lifelong thing that you have to deal with until death. So I would recommend you using the iodized salt when you're cooking, but as long as in moderation, it would be helpful. A lot of the things is you have to do it in moderation. You can do it more, you can do it less.
Thank you for that. I guess my question will be, she mentioned before like vitamin D. We